Well, good evening, everyone. My name is Robert Brody, and I'm an assistant professor of ear, nose, and throat surgery and head and neck surgery at the Hospital of the University of Pennsylvania in Philadelphia, PA. Thank you, everyone, for joining us for this Healing from Within, Managing Fatigue and Sleep Challenges in Head and Neck Cancer. This should really be a great session today. Treatments for head and neck cancer, including surgery, radiation, and chemotherapy, can greatly affect energy levels and disrupt sleep patterns. Persistent fatigue and sleep disturbances are common yet often overlooked challenges that can significantly impact patients' recovery and overall quality of life. This webinar aims to provide practical strategies and essential insights for patients and survivors coping with fatigue and sleep disruptions during and after head and neck cancer treatment. Today's expert, medical presenters, and an Alliance ambassador will discuss root causes of fatigue and sleep disturbances and will provide practical techniques to manage these challenges so that physical and emotional well-being are enhanced. Just wanted to let everyone know for some housekeeping measures that throughout this event today, we have a Q&A as well as a chat that you are welcome to please enter your questions into. We will be looking at this throughout the webinar, and our hope is that we can answer them either by text throughout the chat, throughout the whole presentation, and then at the end we'll have a special question and answer period of time where we can really dive deeper into these questions with our panelists. So to begin, I would like to introduce you to our HNCA ambassador, Sydney Stemple. Cindy is a survivor of oral cavity cancer. She's experienced severe bouts of insomnia post-treatment, both due to physical discomfort of the long-term side effects of treatment and the general anxiety that has increased exponentially in the aftermath of treatment. She now has a very good sleep regimen, including strict evening routine, making use of sleep focus mode on her phone to enforce boundaries with technology around bedtime, and bullet journaling to track trends related to sleep, anxiety, and habits, as well as expressing her anxious and intrusive thoughts before bed. Cindy also has experience with medically recommended supplements to help support sleep, such as melatonin and magnesium, and has employed a lot of strategies to help her relax and get comfortable before bed. In addition, she sees a therapist to help with her anxiety and intrusive thoughts. We're very excited to have Cindy here and look forward to her discussing all of this in more detail. Welcome, Cindy.
Thank you, Dr. Brody. As he mentioned, my name is Cindy Stemple. I am an ambassador for the Head and Neck Cancer Alliance and a young adult survivor of oral cancer. I won't spend too much time on the details of my diagnosis and treatment, but the Cliff Notes version of my story is that when I was 27, I discovered a sore on my tongue. And after extensive testing for everything except cancer due to my age and lack of risk factors, it was finally biopsied and turned out to be oral cancer. I had surgery to remove the tumor and many lymph nodes and then went on to do 33 radiation treatments. And then unfortunately, when I was 30, my cancer returned, and this time I had a much more aggressive surgery to reconstruct more than half of my tongue, the floor of my mouth, and the gums on the right side. At the time of each of my diagnoses, I was extremely active and busy. I was working full time and my career was starting to take off. And I was also working toward my MBA in an in-person program most evenings during the week. And when I wasn't working or going to class, I was involved in a variety of community choral ensembles, as one of my passions in life is singing. And my undergrad degree is actually in music. And while I have since graduated from my MBA program following treatment, I have continued to work a demanding job. I also volunteer for a variety of cancer-related causes. I still perform regularly, and I am a first-time mom to a toddler who just turned 2 this week. So I think you can see why managing sleep and fatigue have been really important in my experience, both during and after treatment. As was mentioned in Dr. Brody's introduction, there have been a lot of things both during and after my diagnosis and treatment that affected sleep, including pain and discomfort from the treatment itself, and also just the mental and emotional toll of having survived cancer. The other experts on this call are going to share plenty of fantastic advice and tips for things that might help. But I'm going to share a few general things that I found helpful along the way, and also a few examples of things that specifically helped. So my first general tip is to try some of the recommendations you'll hear today that you think are going to be the easiest to implement into your life and your routine. Treatment and recovery are hard enough, so definitely reach for the proverbial low-hanging fruit first. So for example, for me, this included utilizing the sleep focus mode on my phone to remind me to shut down my technology in preparation for bedtime. And I also incorporate reading physical books into my bedtime routine to help me wind down. Another easy change for me to implement was listening to ASMR audio tracks on apps like Calm or Headspace, or even using free videos on YouTube to help me fall asleep at night. I found that this audio helped calm my racing thoughts from anxiety a lot more than traditional white noise. And if you haven't tried listening to Matthew McConaughey tell you a bedtime story, it's absolutely worth giving a try. Also, it may seem counterintuitive, but being more active during the day, if you can, also helps, and a little bit goes a long way. I often try to take a walk during lunch around my neighborhood, or even just try to get a few steps in on the treadmill if the weather does not allow me to get outside. And then one last quick fix to recommend, particularly for head and neck cancer survivors, keeping water on my nightstand to help with dry mouth in the middle of the night. It helps prevent me from needing to get out of bed to get a drink. And so that was also a very, very easy change for me. My second tip is, after you've tried the quote easy changes, talk to your doctor about whether other supplements or therapies might be a good fit for you in managing sleep. This is not the time to be stoic. Cancer, frankly, sucks, and your doctors want to know if they can help you get through it. Sleeping helps your body heal, and every doctor and oncologist I have approached with this subject has been incredibly helpful and supportive. After discussion, my doctor and I landed on a combination of melatonin and magnesium, which has been a really good fit for me in helping me achieve a good sleep routine. But every person is different, and something else might be a better fit for you. One of the things I did to help quantify how much I was struggling with sleep at certain points during treatment and recovery was to track my sleep and energy levels in a bullet journal. And you could see mine here in the picture on the right. I was able to use this to show my doctor the patterns I was noticing month after month, and this really helped find the right treatments to help. And then finally, after you've done all of that, consider exploring some other causes of sleep disruption or lack of energy that might not be as obvious. So for example, I mentioned I struggle with anxiety. Seeing a therapist regularly has helped me manage that in a very impactful way that has really helped my sleep and overall energy. My therapist also helped me tailor my journaling more effectively to clear my mind before bed. I also use a pneumatic pump, which you can see in the photo on the left, that mimics the lymphedema massage done by physical therapists to help some of the symptoms that flare up and affect my sleep from time to time. Because I'm able to manage my sleep and fatigue pretty well, I've been able to continue to grow in my career, keep performing in ensembles across the Midwest, and I can better keep up with my adorable little girl when she wants to go, go, go like the Energizer Bunny. The sleep and fatigue is not always something that can be fixed permanently, and it may need some ongoing trial and error and discussion with your doctors to stay on top of it. So with that, I'm going to turn it over to the experts who will have even more to share that can help you manage it.
Thank you so much, Cindy. And we're looking forward to talking with you further at the end of this session. So next, what we'd like to do is welcome Dr. Barwick. Fiona Barwick is a clinical associate professor in the Department of Psychiatry and Behavioral Sciences, Sleep Medicine Division at Stanford Healthcare. She is director of the Sleep and Circadian Health Program and serves as Associate Division Chief for Behavioral Sleep Medicine. And we are very excited to have her here today to discuss her expertise in this field.
Thank you so much for the introduction, Dr. Brody. Just a quick, I have no relevant conflicts of interest to disclose. My area of expertise is behavioral sleep medicine. This focuses on the evaluation and treatment of sleep and circadian disorders by addressing behavioral, psychological, physiological, familial, and sociocultural factors that interfere with sleep. There are a lot of things that impact sleep, which is good news because it means there are a lot of places you can intervene to improve sleep. I always like to encourage people to understand sleep from this three-part system. The first system you want to know about is a circadian system. Circadian rhythms are biological rhythms that fluctuate across the 24-hour light-dark cycle, regulate a lot of our behaviors. For example, when we feel sleepy, when we feel wakeful, when we feel hungry. They regulate hormones that impact sleep, changes in melatonin and cortisol. They regulate our body temperature, which also affects sleep. From a circadian perspective, you want to figure out the right sleep schedule for your body clock. A little different for everyone. This is partly genetic. Some people are going to feel sleepy at 10 p.m. Others won't feel sleepy until 2 a.m. So some people are more morning, some people are more evening. You want to figure out the right schedule for you, and then you want to keep that schedule consistent and use light and dark exposure strategically. We'll talk more about what I mean when I reference that in just a moment. The second system you want to understand is your sleep drive. It's a biological drive that works like hunger. With hunger, the longer you go without eating, the hungrier you get. Sleep is similar. The longer you go without sleeping, the hungrier you get for sleep, which means when you get to bedtime, you're going to fall asleep faster and get back to sleep faster. There are ways to maximize your sleep drive, which again, we will talk about in just a moment. And finally, one of the most important aspects of transitioning to sleep is moving from a stressed state that we're all in during the day to a greater or lesser extent to a more relaxed state. We want to reduce any hyperactivation, any hyperarousal that inevitably occurs when we're awake and doing things. So you want your mind to be calm, your body to be relaxed. You want that arousal to be low. None of these three systems guarantee sleep because the only thing that guarantees sleep is staying awake long enough. But if these things are in place, it's more likely sleep will unfold. So let's take a look at what this looks like across a 24-hour period. Sleep is a 24-hour phenomenon. And in fact, you can do more things to affect your sleep when you're awake than you can when you're asleep. Because after all, when you're asleep, you're asleep. So let's break the day down into 4 parts, and we'll start with the morning. The first thing when it comes to your morning time, keep a consistent morning rise time. Now, again, you want to make sure you're in the right sleep window for your body clock. Once you figure that out, you want to set a consistent morning rise time because that, more than anything else, is going to keep your sleep on track. It's going to set the timing for sleep the coming night. It's going to create a nice, strong sleep-wake rhythm. 2, you want to get up promptly. Lingering in bed, very common. We often wake up groggy. That doesn't necessarily mean anything about your sleep. It can often reflect melatonin leaving your system. When melatonin is in our system, mood is low, energy is low. You never want to linger in bed in the hopes the grogginess will pass because that's not going to help. What helps is getting up promptly and getting light, movement, and food. When I say light, I mean outdoor light, not through a window. You actually have to stand in front of a window 5 to 10 times as long with your nose pressed against the glass to get the same amount of light as you would by stepping outside for 5 or 10 minutes. When you step outside, that increases your body temperature, and the light itself helps to suppress melatonin. Getting some movement, moving around, even if it's slow, doesn't have to be much. You can get up, putter around, make your coffee, have a little breakfast, maybe step outside. That also increases your body temperature, which gets rid of melatonin more quickly. And finally, having something to eat, even if it's small, helps increase body temperature as well. All of this, like I said, gets rid of melatonin faster, increases cortisol, increases dopamine, all of which help you feel less groggy, more alert, and in a better mood. So that is an optimal routine for sleep in the morning. An optimal routine during the day is to maximize your sleep drive. This is the best time to do it. How do you maximize it? Well, you want to make sure you are not napping too long or dozing too late. So you want to keep your naps to 30 minutes or less and make sure they're 7 to 9 hours before your bedtime. Why do you want to do this? Because you want to prevent yourself from going into deep sleep. Deep sleep is what will interfere with the sleep the coming night. And the longer you nap or the later you nap, the more likely you are to go into deep sleep. Now, granted, if you're going through treatment and you're particularly wiped out, you might need to give yourself a little extra rest time or recovery time, but you just want to be cognizant of the fact that if you try to sleep too long during the day, it will interfere with sleep at night. On the converse side, you can build your sleep drive by being awake longer and being active. Physical activity is one of the best ways to build sleep drive. Even if all you can do is walk for 10 or 15 minutes outside, I should mention, in addition to physical activity, outdoor light exposure helps. So if you're able to walk for 10 to 15 minutes outside, that's still going to be better than resting inside in the dark. So making sure you limit napping, make sure you maximize physical activity, even social activity helps, getting outdoor light, all of this helps to build your sleep drive, which will help with sleep the coming night. So that's an optimal routine during the day to help with sleep. Now, what about in the evening? What's an optimal evening routine? Remember, this is one of the most important parts because you're transitioning from the stressed, wakeful state, which again, we are all in when we're awake. It's the cost of being awake. You're transitioning from the stressed, wakeful state to a more relaxed state. So how do you do that? First important thing is to find a toolkit or develop a toolkit of relaxation strategies that you enjoy and that you use regularly. I'm going to talk in more detail about this in a moment. I'm not talking about distraction here. So watching TV, reading, that's fine, but it's not going to engage our relaxation response in the way that some very specific strategies will. Again, I'll talk about those in a moment. You also want to use deliberate strategies to offload worry and stress that's built up during the day. One great way to do this is to designate a worry time. So you set aside a time, usually later in the day, not too close to bedtime, 3 hours or so before bedtime, and that is your worry time. So let's say my worry time is 5 p.m. During the day, I'm going to write down any worries that come up and I'm going to set them aside. And then when 5 o'clock comes around, I'm going to take out that list. I'm going to sit down with a 3-column piece of paper. In the leftmost column, I'm going to write down whatever worries or concerns have come up during the day. In the middle column, I'm going to indicate whether or not I have some control over this worry or concern. Is there something I can do about it in 5 or 10 minutes that night or the next day? In the final column, if there is indeed something I can do about this, make a phone call, send an email, I will write that down. However, if this is something that is not in my control or there's nothing I can do to address it tonight, I'm going to write that down. I'm doing everything I can for now. Nothing more I can do tonight. I'm going to let it go for tonight. When you do this, you actually give your brain closure, and your brain is less likely to get stuck on things for which it has closure. The important thing to realize is when we fall asleep, our brain shuts down from front to back. So the first part of our brain to go offline is the frontal lobes, which is where our executive functioning is located. Our reasoning, our problem solving, our emotion regulation is offline at night. And the part of the brain that gets amplified is the limbic system, the emotional brain, which is why it is so easy in the middle of the night to get hijacked by the emotional brain and spend 2 hours, 3 hours worrying about things that we can't control or do anything about in the middle of the night. And in the morning, it looks very different. You want to prevent that from happening by offloading the worries or concerns before you even get into bed. You want to make sure you give yourself an hour before bedtime to get off your screens, light of any kind, but particularly blue enriched light from screens, because blue is our most powerful alerting cue. So blue enriched light from screens, really any light, will suppress and delay your melatonin, which is supposed to start going up an hour and a half to 2 hours before your bedtime. So you want to make sure an hour before your bedtime you get off your screens and do activities that are relaxing and enjoyable, not too stimulating. You want to be able to put it down easily. Maybe reading a book, maybe doing a book of crossword puzzles, maybe playing a game with a deck of cards, maybe listening to relaxing music. Whatever it is that you find enjoyable and relaxing, you want to do that in the hour before bedtime. And once again, you want to sleep with your body clock. We'll talk more about going to sleep when you're sleepy versus tired, but you want to go to bed when you're sleepy. And finally, what is an optimal thing? What are the optimal things to do at night? We'll talk more about this first one, which is make sure your bed is a strong, clear cue for sleep. So that means sleep only in bed. Do not sleep anywhere other than bed. Do wakeful activities somewhere else. When you do this over and over again, it reinforces the association between your bed and sleep. And your brain literally learns that bed means sleep. It gets excited when it sees the bed. It's like teaching a puppy that leash means walk. When you bring the puppy home, you take out the leash, it means nothing to the puppy. But if every time you take out the leash, you go for a walk, puppy learns leash means walk, gets excited when it sees the leash. You want to teach yourself the same thing when it comes to bed. You want your brain to be excited when you see that bed, excited for sleep. And finally, you want to spend the appropriate amount of time in bed. I mentioned that there's normal variability between people in terms of the timing of sleep. There's also normal variability in terms of how much sleep we need. You want to figure out how much sleep you need. It's going to depend on who you are and where you are in your lifespan, because it changes across the lifespan. And then you want to sleep in that window. That's the sleep opportunity you want to give yourself. Not too much time in bed, not too little time in bed. The range of normal time in bed, with the expectation that most of that time you'll be sleeping. For 26 to 64-year-olds, it's 6 to 10 hours, on average 7 to 9 hours. For 65 folks who are 65 and older, it's 5 to 9 hours, on average 7 to 8 hours. That's time in bed. That's not sleep, but the expectation is most of that time you'll be sleeping. So these are optimal routines to help with sleep for the morning, the daytime, the evening, and the nighttime. I mentioned fatigue versus sleepiness. Sleepiness is literally the propensity to fall asleep. You could put your head down and fall asleep. How do you know? Your breathing might slow, your eyes might get heavy, your head might start to nod. These are all signs of sleepiness, signs that you have built up sufficient sleep hunger during the day by being awake and active, so you could now fall asleep. Sometimes it's due to sedating medications, sometimes a cold or a flu, but generally it's sufficient sleep drive. Being tired is different. Being tired is feeling physically or mentally wiped out, depleted. There are so many reasons other than sleep that cause you to feel tired. Spending too much time in bed can leave you feeling tired. Not being physically active enough or socially active enough can leave you feeling tired. Being bored, spending all day on screens, being stressed, in a bad mood, anxious, depressed, in pain, all of this is associated with fatigue. Not drinking enough water or not eating regularly during the day, crashing from caffeine, being hungover from alcohol, certain high carb, high sugar foods, all of these can cause us to feel tired during the day. If we're low on iron or vitamin B12 or vitamin D, if we have an infection or a cold, if we have an untreated medical condition like sleep apnea, all of these are associated with fatigue. Why is this important? When people confuse these two things, they end up doing the wrong things and not doing the right things. I've seen this happen a lot where people will work very hard on improving their sleep. They finish and sleep looks great, but then they'll come back and they'll have increased the time they spend in bed. And when I ask them why, they'll say, well, my sleep is good, but I'm still feeling tired during the day. And when we look at all these other reasons for fatigue, they can identify probably 4, 5, 6 that are impacting their level of fatigue. So not only do people end up doing the wrong things, like increasing the time they spend in bed when they confuse fatigue and sleepiness, but they don't do the right things, meaning they don't identify the things that are actually causing the fatigue so they can properly treat them. I touched on this a bit, associating the bed with sleep. You've already heard me say, go to bed when you're sleepy, get up at the same time every day, do all wakeful activities outside of bed, sleep only in bed. But this final point here, get out of bed if you're awake at night. What you're trying to do, you're not only trying to create an association between the physical site of the bed and sleep, you're trying to make sure that you are not lying awake in bed, getting anxious, frustrated, discouraged. Because guess what? As soon as you lie in bed trying to force sleep, getting frustrated, anxious, and discouraged, your bed gets associated with that whole emotionally distressed state. And now your bed is no longer a cue for sleep. It's a cue for anxious, activated alertness. I hear this all the time. People will literally come in and tell me, I don't get it. I'm sitting in front of the couch in the living room. I'm sitting on the couch in the living room in front of the TV in the evening, and I'm falling asleep. And then I get up and go to my bed, and I lie down and I'm wide awake. That is because, number one, it's the evening, so your sleep hunger is high. Number two, you're relaxed. You're watching TV. Number three, you are not trying to sleep. You're in fact trying to stay awake. As soon as you start trying to sleep, you guarantee you're going to wake more. So here you're on the couch, sleep drive is high, you're relaxed, you're not trying to sleep, and so you're falling asleep. When sleep is working, it's a totally passive effort. Anxiety descends. Now you're worried. What am I going to do? What's sleep going to be like tonight? You get in bed and you're starting to try to make sure sleep happens, and now you're awake. So the best thing to do if you happen to be awake at night is not lie in bed, tossing and turning, trying to force sleep, waiting for it to come. If you're truly awake, get out of bed, be awake for a bit in a more relaxed and enjoyable way somewhere outside of bed. Do that for 30 minutes, and when you come back to bed, it's usually easier to fall back asleep. You're doing several important things here. Number one, you're making sure your bed remains associated with sleepiness and sleep. Number two, you're distracting yourself in an enjoyable way so you don't get caught up in the frustration and the anxiety and the discouragement. And number three, you're actually building more sleep hunger by standing up, walking into another room, and sitting up for 30 minutes than you will by lying in bed, tossing and turning. Now, I mentioned the importance of this transition state between a wakeful stress state and a relaxed state as we approach bedtime. These relaxation or self-regulation strategies are all about using particular techniques to shift from a stress state to a more relaxed state. Things like diaphragmatic breathing, progressive muscle relaxation, body scan, mindfulness, meditation, self-compassion, gentle yoga, prayer. All of these things share a focus on the present, whether you're focused on breathing or sensations in the body, whether you're focused on the present moment, as you might be with meditation or mindfulness. Usually our mind is not focused in the present. It is caught up in the future, worrying, fantasizing, or stuck in the past, ruminating, recriminating. Both of these places involve suffering. When we bring our attention into the present moment, that can be calming because right here, right now, things might be okay. We are alive, we are breathing, we are safe, we are sheltered, we are fed. When we allow ourselves to remain in the present, that can be inherently calming and relaxing. And all of these techniques allow that to happen. These are things you can do before you get into bed, after you get into bed, if you're awake at night. As I said before, it's very important we have a toolkit of more than one of these strategies that we know and that we enjoy doing for those times that we're awake at night, because those times are going to be inevitable for all of us. These are some common sleep myths. I'm going to go over them very quickly, but I will say there are a lot of misconceptions about sleep. The misconceptions increase anxiety, and anxiety increases wakefulness. So the more accurate your understanding of sleep is, the better for your sleep. First myth, I must get 8 hours of sleep to function the next day. I already told you that's not true because sleep need differs between people. Remember, on average, 26 to 64-year-olds, it's 7 to 9 hours in bed on average, with the expectation that most of that time will be spent sleeping. But some people it's 6 hours, some people it's 10 hours. So it varies between individuals. It changes with age. We tend to get less total sleep as we get older. And even if you happen to be someone who needs 8 hours of sleep and you only get 6 or 5 or 4, will you really be unable to function? If that were true, our species would have died out millennia ago. We are biologically designed to adapt to circumstances where we cannot get the sleep we need or want. You can imagine if you wake up at night and you look at the time and you think, oh, I need to get back to sleep right now, otherwise I won't get my 8 hours. Are you getting back to sleep anytime soon? Probably not. This next one, if I've had good sleep, I should wake up feeling refreshed. I already mentioned that it's common to wake up feeling groggy because melatonin is often still in our system when we wake up. Worst thing to do is linger in bed, waiting for it to pass. Best thing to do, get up, get light movement and food. So you never want to base your assessment of how you slept on how you feel the moment you wake up, because that can be misleading. You want to look instead at how you're feeling and functioning during the day. You know you're getting the right amount of sleep when you feel alert and well rested during the day, apart from a bit of morning grogginess, a dip in the afternoon, and some sleepiness toward bedtime. And imagine you wake up feeling unrefreshed, a little groggy, and you immediately think, I didn't sleep well and today's going to be bad. Guess what? You just guaranteed yourself a bad day. This next one, I wake up a couple times each night, fall back to sleep quickly, but it can't be good for my sleep. This describes normal sleep. On average, adults wake up 10 to 12 times a night. We won't remember most of them. If we're awake for less than 3 minutes, we won't remember. So if an adult tells you they slept through the night, they did not. If you remember 0 or 1 or 2 awakenings, that is normal sleep. Again, imagine you're waking up and you think, something's wrong. I shouldn't be awake. What's happening? Are you getting back to sleep anytime soon? Like I said, probably not. If I spend more time in bed, I'll get more sleep and feel better the next day. I already talked about how that can backfire. We have a finite amount of sleep our body produces that differs between individuals. It depends on our age. If we start spending a lot more time in bed than we can fill with sleep, our sleep will get fragmented. We'll start spending a lot more time awake. So the correct statement is, I want to spend the amount of time in bed that I need. Not too much, not too little. The next one, I need to try harder to sleep or to make up for lost sleep. What happens when you try to force sleep? Does it work? I already mentioned when sleep is working, it's a totally passive, effortless process. The more you try to force sleep, the more you're going to be awake. My sleep system is broken and cannot be fixed. If your sleep system were truly broken, if it were not producing sleep, you would die in 2 to 3 weeks. I will never see someone whose sleep system is broken. It's usually what people are doing or not doing, thinking or not thinking, that is interfering with sleep. And finally, if I don't get enough sleep, I need to do less the next day because I won't have enough energy. This is a fundamental misconception. There are activities that give us energy, and being awake and active is what builds sleep drive. So the last thing you want to do is start cutting back on activities the next day. Go through your day the way you normally would, maybe a little bit more self-care if you're really, undergoing treatment, you're particularly fatigued or discouraged, but generally try to keep up your activity level, because the way sleep works, if you get poor sleep one night, it's usually better the next night. The sleep system is self-correcting when we let it. I'm going to touch very briefly on 3 sleep disorders you want to be aware of: insomnia, problems falling asleep, staying asleep, waking up early, unable to get back to sleep. A highly effective treatment for insomnia, including for individuals with cancer, cognitive behavioral therapy for insomnia. Very effective and information-based and skills-based therapy, very targeted, time-limited, usually 4 to 8 sessions, natural approach, no medications, no devices, multi-component, so the behavioral components, cognitive components, relaxation techniques, and it is considered the gold standard treatment endorsed by every major medical organization worldwide. Sleep apnea is also common in individuals with head and neck cancer. So sleep apnea are pauses in breathing caused by obstruction of the upper airway. These pauses in breathing are often associated with a drop in oxygen levels, sometimes an arousal, an awakening. This is, of course, if we're not getting oxygen because we're not breathing, either completely or partially, multiple times throughout the night. This is very stressful for the heart, stressful for the brain. There's very effective treatment for it, which is called positive airway pressure. And finally, restless leg syndrome. These are restless, twitchy, uncomfortable, sometimes painful sensations that come on in the legs toward evening. Feel worse if you're sitting or lying down, feel better if you get up and move around. Often accompanied by low iron levels, so sometimes an iron supplement can help. There are also medications for this. I'll wrap up and leave you with a quote. It happens to be my quote. Sleep is not a performance, except when you're awake. You have the power when you're awake to do things to help with your sleep at night. But once sleep happens, whatever happens, happens. Thank you.
Thank you, Dr. Barwick, for all that information. We've gotten a lot of great comments in the chat, and we also have the Q&A section just to remind everyone of. We'll try and answer some of those questions right away, but we'll also reserve some of them, I think, for our Q&A session at the very end. And so I'm very honored to welcome our final panelist today. This is Dr. Alison Taba. Alison is a senior physical therapist at Stanford Healthcare. A breast cancer survivor, Dr. Taba gained a deeper understanding of how physical therapy can support cancer patients in returning to an active lifestyle and enhancing their quality of life. She works very closely with patients, providing physical therapy interventions before, during, and after treatment. Her efforts lead to successful outcomes, including reduced fatigue and pain, improved strength and balance, and minimized lymphedema. Welcome, Dr. Taba.
Hi, thank you for that. I do work primarily with cancer patients in my practice here at Stanford. And I have to say that one of the most common side effects that patients report as a result of their treatments is fatigue and sleep disturbances. So a lot of the information that Dr. Barrett presented is a lot of also what I like to, or I try to convey to my patients too, regarding sleep hygiene. So what I wanted to focus more on is what is cancer-related fatigue and how the benefits of exercise can help to mitigate some of the side effects of that. All right, so what is cancer-related fatigue? So according to the National Comprehensive Cancer Care Network, cancer-related fatigue is defined as a distressing, persistent, subjective sense of physical, emotional, and/or cognitive tiredness or exhaustion. This is related to the cancer itself and then cancer treatments, but it's not necessarily proportional to the amount of activity that someone has gone through, and definitely interferes with your function. So essentially, in summary, it's just this overwhelming feeling of tiredness. Sorry, can you still hear me? Okay. Sorry about that. So this overall feeling of tiredness that definitely interferes with your ability to perform your daily activities, interferes with your sort of emotional well-being, and then definitely leads to low motivation, low energy, affecting your quality of life. So some of the symptoms of the cancer-related fatigue is just feeling an overall weakness, muscular weakness, having difficulty concentrating, feeling, again, like I was saying, a low energy level, low motivation, And unfortunately, these symptoms can last for weeks to months or even years after you completed your treatments. And the intensity of the fatigue can vary between individuals. Some patients, unfortunately, not so much, but then some it can very definitely affect their day-to-day activities. So the mechanisms for the cancer-related fatigue, it's not completely well understood. There's definitely a lot of factors that go into it. So what I wanted to touch on are just like key points that some of the research has gone into. So one of the reasons for the cancer-related fatigue is basically it's your body's energy competing between the fighting off the cancer and also recovering from the cancer treatments. So basically it's the cancer itself and the treatments such as chemotherapy, surgery, radiation. These will disrupt like your normal metabolism, cell functioning. It'll damage your healthy cells, and then this then interferes with your immune system. So it weakens your immune system, leading to fatigue. And another reason for the cancer-related fatigue is this inflammatory cascade. It's something that is not completely understood. There's a lot of things that kind of happen with this inflammatory cascade. So essentially, it's a molecules that your body releases that normally causes an inflammatory response. So that's the normal way that your body heals. Your immune system starts an inflammatory response. But in terms of cancer-related fatigue, this system that keeps going. There's an increase in these molecules that keeps the inflammatory state going. And then when this state keeps going, then it's going to interfere with your sleep cycle, again, your energy level, and also your brain functioning, contributing all to the fatigue. Also, the fatigue could be just general deconditioning, right? So you have less activity, so there's going to be a little bit of muscle weakness, and also low stamina, again, leading to low energy and your fatigue. So what I also want to go through is like the benefits of exercise. So that's one of the things that research has been showing that can be very beneficial to fighting off some of the cancer-related fatigue. So how is exercise beneficial? So it's been shown that it can reduce general fatigue, your emotional fatigue, and physical fatigue. And it's been shown to be safe to undergo while you're going through treatment. So oftentimes patients that I see will be going through exercise programs during their treatment, and I'll even see them for months to, actually a few months after they're done, because then there's also modifications that we can make with the treatments depending on how they're progressing. And what has been shown to be most beneficial is a combination of both aerobic and resistance exercise, and also yoga or some type of flexibility exercise. The American College of Sports Medicine International Multidisciplinary Roundtable convened to just form these general guidelines. And what they have found through research is just these guidelines that I'll go through that will help to mitigate some of that cancer-related fatigue. So what they have found is a training program that lasts about 12 weeks, and either doing moderate intensity aerobic training 3 times a week, or the combination of this moderate intensity aerobic exercise and resistance training 2 to 3 times a week. So the aerobic training is gonna consist of 30 minutes. So the 30 minutes can be a goal to get to. Cindy had mentioned earlier, like, to just try to do what you are able to do. So even if it's just starting with like 5 minutes, like a couple times a day, progressing to maybe 10, 15 to make a goal of getting to the 30 minutes. And in terms of the resistance training guidelines with sets of repetitions, starting at about a 60% of your 1 rep max. So what a 1 rep max is the maximum amount that I can lift one, not able to do it again. So to keep it simple, say I can bicep curl like 10 pounds, I'm going to start with 60%, like 6 pounds of that. So that would be a good starting point with the exercise program. So now exercises, like specifically for head and neck cancer, there's very limited research on it. Unfortunately, most of the research has been done more with breast, lung, colorectal cancer, prostate cancer. But with what limited research there is, they are finding that it is, again, more the combination of the aerobic and resistance exercise that has been most beneficial. What they've been showing is that resistance exercise alone doesn't have like a statistically significant impact on increasing strength and decreasing fatigue. So it is, again, more the combination of the aerobic and the resistance exercises. And what they're postulating is that aerobic exercise probably has some type of anti-inflammatory mechanism that helps to, you can say, like, decrease muscle breakdown and help to enhance the muscle strengthening. So again, combination of both is going to be most beneficial. What I want to go over are just kind of general guidelines of how to get started with exercise. But before you start any type of exercise program, just make sure that you do consult your oncologist, your cancer team, to make sure that you are well enough to start an exercise program. And with a lot of the research, it's showing that like a supervised type of exercise program can be a little bit more beneficial than just doing something individual or a home exercise program. So it can be beneficial to just consult with a fitness professional, like a physical therapist or an exercise physiologist. And then also in that way, they can create more of an individualized exercise program for you, depending on like where you're starting, your needs, your abilities, and then what your goal is in terms of like where you want to get to with, even if it's just like getting back to daily activities, or if it's some type of like a sport that you want to get back to, it can be very much more individualized to what your goals are. Okay, so I want to go through 3 phases of cancer rehab. So again, these are just very general phases that have been broken up into based on where you are in your cancer treatments. So with the first phase, it's usually if someone's going through treatment, chemotherapy, or radiation, you're going to start more at like what we consider a low intensity. And the low intensity, you're going to take it at about 30 to 45 heart rate reserve, so at a target heart rate. And I'm going to go over the target heart rate and the RPE in the next slide. But basically, those numbers will be associated with what a low intensity is. And you're going to start maybe 2 to 3 times a week. And this phase will usually last for the duration of your treatment. But again, that can vary depending on the progress of and how the patient is feeling. So once you're done with phase 1, no side effects, then you move on to phase 2. But you can also start at phase 2 if you're not necessarily having to go through the chemotherapy or radiation, because that definitely is going to suck a lot of your energy. But if you're not having to go through that, then you may be starting in something like phase 2, where you're be progressing more to like a moderate intensity level. And again, with the heart rate reserve or the target heart rate and the RPE, I'll go more into what those numbers mean in the next slide. But those numbers will be associated more with moving towards a more moderate intensity activity. The 3 months, that's just a general guideline again. And again, it's really going to depend on how the person is feeling, like where they are in terms of their cancer treatments too. Okay, so the third phase, so after you've completed the other 2 phases, then you can start to move more into this moderate to higher intensity. And again, these numbers with the heart rate reserve and RPE are associated more with how you can, I guess, judge or monitor where you are or how to exercise at that intensity. So I had listed 2 equations, one to find your maximum heart rate, the other is to find your target heart rate. So these 2 equations are a little bit more accurate in determining where you should be in terms of like the heart rate reserve. It's going to be more specific to the person based on their age and their resting heart rate. So for example, if you take the maximum heart rate, you're going to plug in your age. You're going to take that and then plug it into the next equation, maximum heart rate, and then taking into consideration your resting heart rate, which is the HR at rest. And then you're going to multiply by the percent intensity, add back in your resting heart rate. So essentially, you can use this equation to formulate more a range of the exercise intensity. So for example, in phase 3, you'll calculate it one time at the 60%, and then again at the 85%. So then you'll have a target heart rate range for which to work through or work from. So maybe starting at like the lower end and then progressively start to get up to the higher end with a goal of getting up to the higher end of the target heart rates for phase 1, 2, and 3. The chart that I listed next is the RPE scale. So it's a rating of perceived exertion. It's a scale that goes from 0 to 10. So this is a really nice way that if the heart rate is not something that you're comfortable following or computing, the RPE scale is an alternative. So you'll either look at it as the amount of, I guess, intensity that you're working on with the exercise. So for example, like the light intensity was numbers 1, 2, and 3. So it should feel easy when you're doing the exercise or the activity. Or you can also look at it as like a talk test. So the third column is more of a talk test. So with the light intensity, you should be able to have a conversation, sing a song. It should be something that you can carry on for hours and then not feel like you're becoming out of breath or exhausted. And then the corresponding numbers, 3, 4, 5, moving all the way up. Again, you can look at it more as the intensity or the talk test. So this is a very kind of easier way to guide your exercise. But I always tell patients to make sure that when you're exercising, regardless of what you're doing, never exercise to the point of shortness of breath. And also never exercise to the point where you just feel like fatigue in terms of like if you're doing resistance, like you just cannot lift anymore. Because still your body is having to recover, especially if you are going through treatment. It's really about activity pacing, right? So I had talked about with the aerobic activity that, you can start, with just 5 minutes and progress up. Even with the resistance training, I mean, maybe you're going to do just 1 set and then progress to doing a couple sets. But a lot of it is the activity pacing with the exercises. And again, give yourself some grace. You've come a long way. Definitely exercise and sleep hygiene can definitely help you mitigate the effects of the cancer-related fatigue. So that's well, all that.
Great. Well, so I'm going to welcome all of our panelists here now. We've had some great questions throughout the session, and if you please look at the chat, you'll see that we've been able to answer, I believe, all of the questions in the chat currently. There was a question earlier on in the Q&A that has discussed, my apologies, from Christine, who mentioned that she still has exhaustion during the day to the point of quitting her job and reevaluating what she can do with her career. Are there any suggestions on how to get through the day? She gets exhausted very easily on the job. Is it radiation, 3 years out and still exhausted? Bit of a hard question to answer. Obviously can be related to sleep. My first comment, just from a medical perspective, is that it's always very important, I think, to think about survivorship. In addition to sleep, there's other endocrine issues that can occur after having had radiation. So certainly I imagine you're well taken care of, but if you haven't had your thyroid function tested recently, that can also lead to a lot of fatigue, especially after radiation if you're hypothyroid. And I am actually curious from Dr. Barwick how thyroid function affects sleep as well, and whether people should be looking out for that as they're managing their sleep.
Very much so. When thyroid levels are high, that can lead to insomnia. When thyroid levels are low, that can lead to fatigue. So definitely getting thyroid functioning checked out would be important. Once you've done that, I'm not sure. There's another question in chat. How long does fatigue last? I imagine that varies. Dr. Brody, you're probably better positioned than me to answer that question. Alison, you may have some ideas as well. But there are ways to try managing fatigue that don't involve medication. Light is actually an alerting cue. Outdoor light is powerful. There are a couple of questions about light, what you What can you do if you're stuck indoors all day? That's where a light therapy box can be really useful. You want to make sure the light is powerful enough. Indoor light is about 300 to 500 lux, lux being a measure of light intensity. Outdoor light in the morning is 10,000 lux, and noonday sun is about 100,000 lux. So you can see the difference in magnitude. But a light therapy box can go up to 10,000 lux, and that could be alerting. So that might help with fatigue. I've definitely used it with patients who have fatigue for a variety of reasons, and some have found benefit from that. Activity, physical activity can be alerting as long as you're doing it in a safe and appropriate way. And that's where you really want to pay attention to what Alison was talking about, because pacing here is critical. So that's where I look to her for the information she provided in her talk. Strategic napping, again, not napping too long or too late, but napping can sometimes, not everyone feels refreshed with napping, so you're going to need to try it out for yourself, but strategic napping, 30 minutes or less, once, maybe twice a day max. Strategic use of caffeine, if you're someone who actually benefits from caffeine, not everyone does, but using 50 milligrams of caffeine, maybe once in the late morning, might carry you through a bit more of the day. Cold actually is alerting. One of the best but most painful ways to get rid of that morning grogginess is take a cold shower. That'll wake you up. But even cold water, ice cubes, like a little rubbing them on your face, on your hands, that can help you feel more alert. Chewing gum can help you feel more alert. Certainly, you might take a look at your diet. If your diet is higher carb, lower protein, that can increase fatigue. I've had several patients who've changed their diet and noticed some benefit. And there are some, some naturally alerting herbs and spices, rosemary tea, sage tea, mint tea, ginger, turmeric tea. So there are a lot of things you can try. Unfortunately, there's no recipe for what's going to work for whom. This is an experiment, but some of these are pretty benign experiments to run. So those are some of the thoughts I have. Alison, anything to add to that?
Yeah, so going back to activity pacing.
You're turning your computer there, Alison. I think you'll have
Okay.
less feedback.
Sorry about that. Yeah, so going back to activity pacing, especially with patients going back to work, oftentimes they're sitting at a desk, and lack of activity, lack of blood flow definitely is going to contribute to the fatigue. So I usually use a guideline. So, oh, sorry, there's an echo. So usually if you don't move for maybe 20 to 30 minutes, your body is naturally going to start to get tight. So I use that as a guide to make some stretching. And I usually show patients there's some easy stretches they can do sitting, even if it's just to, get up, maybe walk to the bathroom, get something to drink. I tell them to drink a lot of water, so it forces you to have to get up and go to the bathroom. But it's going to be trying to get into a routine, making sure that you're getting up and going back to what Dr. Barwick was saying on the sleep. And if you need to take a short nap, I do tell patients to make sure that you keep it under an hour so that you're able to sleep at night.
To kind of call attention to another question for Cindy. I know you're also a musician, but someone in the audience was asking about kind of you mentioned ASMR and other kind of sounds to go to sleep to. I think this also dovetails with some of the questions related to patients who have tinnitus and are looking for kind of sounds to play that would both, I think, mask the tinnitus possibly and also just help them go to sleep. Do you have any recommendations on that or any more information that you can provide?
Yeah, so I mean, ASMR stands for Autonomous Sensory Meridian Response. But if you just type in an internet search or a YouTube search, there's a lot of different creators out there that make this type of content. If you're familiar with, I mentioned the apps, Calm is one that comes up, and there's a lot of sleep stories that are on there. Headspace is another one that a lot of people use. But if you don't have access to either of those apps or you don't want to pay for them, there is a ton of content on YouTube. A lot of it ad-free even, that you can type in. And usually what I will do is I have a playlist set up on YouTube of videos that work really, really well and help make me sleepy. And I will start that playlist right about the time that my phone alerts me, hey, start winding down for bedtime. Turn off your electronics, and I listen to it. And I have eye mask that has earbuds built into it to block the light and also make it as comfortable as possible to listen to headphones and not disrupt anyone else in my house with whatever I'm listening to fall asleep. So it's really, I think it's a little bit of trial and error to find out what is going to work best for you and what makes you most sleepy. I tend to like things that have a little bit of a story element to them, nothing too stimulating story-wise. Obviously, you don't want an action thriller going on in your ears when you're trying to fall asleep, but having just a little bit of a narrative that's happening kind of helps me take my mind off of whatever has been going on during the day and helps my mind relax enough to fall asleep.
And if I might add something there, because I think someone was asking for scientifically reliable information on music to listen to, pink noise, white noise, brown noise. Sorry, doesn't exist. There's no money to be made in research in these areas. In addition to which, everyone's different. I've learned through hard experience. Some of the things I love, other people hate, and vice versa. So unfortunately, you're stuck experimenting. But the good news is there's so many things to experiment with. Cindy mentioned some great apps, Headspace, and Calm. Insight Timer, which is what this particular participant mentioned, is fantastic. It has the largest library of guided meditations, etc., of any app out there, and you can get it for free. There's a premium version you have to pay for, but you can avoid that. So you're going to have to experiment and find the things you like. It can actually be really fun. I use Insight Timer a lot. I have all my favorites bookmarked, so I would encourage people to do that. Yeah, I think that was all I had to add.
Just to call everyone's attention to some of the resources, we included a PDF in the chat that was posted at 7:53 p.m. So please feel free for everyone to look at that. I also wanted to thank all of our audience members for also providing their own advice. We have some comments related to dry mouth, and some people have mentioned that they use a humidifier. Thanks to Tom Graves for that, as well as avoiding eating and drinking greater than 3 hours prior to going to bed. In addition to the humidifier, my only comment would be that if you have a HVAC or central air, you should really pay attention to your humidistat. Many of these HVAC systems, these systems have these things called humidistats attached to them, and you might not have even seen it if it hasn't been serviced in a while. And that actually helps to control a lot of the humidity in your house. So keep an eye out for that. And we're kind of starting to get near the end of our session, but I thought I would comment on this one last question related to positioning while sleeping. And I was wondering if anyone in the panelists would like to comment on ways of kind of avoiding tossing and turning or helping to maintain comfort related to maybe pillows or bed position, like that.
I can try to comment on that. And I also do want to address a comment about, or a question about magnesium and melatonin, because melatonin is one of the most misused supplements out there. The amount of melatonin our brain releases to help us feel sleepy is 1/1,000,000th of a milligram. So 3 milligrams, 5 milligrams, 10 milligrams of melatonin, which is what I see people using, is ridiculous. You should use like 1.5, 2 milligrams. You want to make sure you get pharmaceutical grade, which is tough to do because a lot of melatonin products on the shelf, since it's not regulated by the FDA, are not going to have in the pill what is listed on the label. There are studies showing that. I don't have stock in any of these companies, but pure encapsulation is one that I think is pretty reliable. But you don't want to take too much melatonin. As for the positioning, that can be really tricky. If there were changes in your airway, and I think that's what this person was suggesting along with dry mouth. I know Cindy had a great idea for what to do with dry mouth, but there are also biotin, which is a mouthwash that prevents dry mouth. Xylomelts are another thing you can use to prevent dry mouth. So you could use those to take care of that. But if you've had changes in your upper airway, sometimes sleeping at a slight incline, about like that can help because gravity is not working as much against you. Gravity is not pulling down the airway and narrowing it, perhaps. You could try a body pillow to keep you on one side or the other. The problem is, I do think a certain amount of positional changing, that's what we all do. It probably prevents some stiffness or soreness in the morning. So you're probably not going to get rid of all of it, but you might be able to reduce some of it.
I just want to second the recommendation of a body pillow. This was something that I did not try until I was pregnant with my daughter, and got one for that purpose and have kept it in my bed since then because it is so helpful for positioning with like neck or between your knees, just to help with some of the physical discomfort. So if you can get a pregnancy pillow really, really cheap, they don't have to be for pregnancy.
And Tom mentioned the viral TikTok pillow, which I'm now going to look up. That sounds very fascinating. But he said that was a huge help in stopping the tossing and turning and preventing the shoulder pain. So thank you for that, Tom.
And then many also have hypersalivation as opposed to dry mouth. That can be aggravating for some. And there's also many treatments for that, one of which can actually just be a Botox injection of the salivary glands, which can help to diminish the amount of spit that one makes. But it's also not a permanent treatment. It lasts for about 3 months, and then you can kind of redose it as you feel necessary. And so, I think we've already gone over by at least 5 minutes here. I really enjoyed this conversation. Thank you so much to our panelists. I wanted to thank again Doctors Barwick and Taba, as well as Cindy, for serving on this panel and providing your insights and knowledge on enhanced rest and sleep for head and neck cancer patients and survivors. A special thank you to the Head and Neck Cancer Alliance and American Head and Neck Society for their time in organizing and hosting the Healing from Within, Managing Fatigue and Sleep Challenges in Head and Neck Cancer webinar. Thank you so much again to our panelists, and also to all of you out there who joined in and kind of have given your own information in the chat as well. We're all stronger together. So have a great night, everyone.